Welcome, everyone, and thank you for choosing to spend time with us today to learn more about my ALS Communication Passport to Quality Care, featuring Karen Steffens, our ALS Support Services Coordinator with the Les Turner ALS Foundation, and Rosie Riley, who is a person living with ALS. I'm Nicole Sammartino, Community Education Manager with the Les Turner ALS Foundation. And I want to give you a better understanding of what to expect today. I want to tell you a little bit about the ALS Communication Passport to Quality Care. The Passport to Quality Care is a tool for individuals living with ALS and their families. This tool helps nursing, medical staff, and caregivers better understand care needs and preferences of people with ALS. This tool is available on our website and as hard copies at our office. I'm going to start us off today by sharing a little bit about the foundation, and then we'll hear from Karen and Rosie, who will talk more specifically about the Communication Passport. So let's get started. As Chicagoland's leader in comprehensive ALS care and research, we realize that people living with ALS may feel overwhelmed and unsure of what questions to ask and what to do next. The Les Turner ALS Foundation exists to care for those affected by the disease, guide them to answers, support them and their loved ones, and provide hope through scientific research. Our support services team is comprised of knowledgeable and compassionate nurses and social workers with many, many years of experience guiding people and their families affected by ALS. This slide shows the variety of services that we offer, including care visits by our ALS Support Services Coordinators, support group meetings, and educational offerings, such as this webinar today. Our Les Turner ALS Center at Northwestern Medicine is led by the most well-respected and successful clinicians and researchers in the field, advancing vital care and research in pursuit of life-enhancing treatments and a cure. The center effectively connects the worlds of research and patient support to ensure the best care is provided and the brightest minds are working hard to find a cure. At the Lois and Salya ALS Clinic at the Les Turner ALS Center, you can tell by this graphic that we offer access to enrollment in clinical trials and dedicated clinical trial coordinators. We are Chicagoland's first and largest multidisciplinary ALS clinic with the highest number of neurologists and dedicated pulmonologists. Multidisciplinary care that brings together an experienced team of neuromuscular specialists in one clinic to provide comprehensive support for you and your family. You'll also have access to no-cost, coordinated support and expertise from ALS Support Services Coordinators from the Les Turner ALS Foundation. Now it's my pleasure to hand the presentation over to my colleague Karen Steffens, who will provide a more in-depth view of the tool and the many benefits of using this tool. Karen has almost 30 years of experience as an RN and has been with the Les Turner ALS Foundation for over 5 years. Prior to that, she was a hospice RN with Journey Care.
Hi, my name is Karen Steffens, and I'm a Support Services Coordinator and Registered Nurse with the Les Turner ALS Foundation. Today, I'd like to briefly share with you a very important and useful tool for those patients who may be compromised in their ability to verbally communicate. For many ALS patients, at some point during the course of their disease progression, they lose the ability to verbally communicate and/or find themselves in a situation where they are unable to relay important and valuable information. And unfortunately, there may not always be a family member or friend close by to help them. For this reason, we wanted to put together a tool to help alleviate those concerns and help them in their methods of communication. Let me share this tool with you and explain a little bit more about how it can be utilized. The My ALS Communication Passport to Quality Care is a pamphlet that puts together specific information for each individual patient. It talks about 3 key areas: things that you must know about the patient, things that are important to the patient, and their likes and dislikes. In the first section, things you must know about me, this covers your demographic information, your name, your address, phone number, birth date, so on and so forth, what language you speak. It talks about who your support system is, who you live with, your primary care physician and other physicians that you may work with. For some patients, they may also see a cardiologist or a urologist. You can put that information in here as well. It has an area for your allergies. This section right here on breathing and heart problems, this is especially key. As many of you are aware, ALS patients should not receive oxygen unless it's administered a specific way, being bled through a non-invasive ventilator. If you need more information on that, please reach out to your physician at clinic or to your support services coordinator with Les Turner, and you can obtain more information. It has an area to list your current medications, vitamins, and supplements. And all of these are important, not just medications, but a lot of vitamins and supplements can interact with medications. So it's important to list everything. And this section is rather small, so there is an area in the back of the pamphlet that you can add additional medications, vitamins, and supplements. There's an area here to list your medical history and treatment plan and what to do if you're anxious. This can be very, very important. Do you lean towards meditation? Do you take anxiety medications? It's important for all your caregivers to be aware, because in the event of a crisis, anxiety is first and foremost. In the next section, it talks about things that are important to you, how you want people to communicate with you. That may be via a computer. It could be with the use of a word or letter board, or something called a boogie board, which is like those old etch and sketch pads. How do you take your medications? Do you take them whole? Do you have to crush them? Are they administered only through a feeding tube? There's many different ways that patients at different stages take their medications, and it's important for all their caregivers to be aware. Also talks about your ability to ambulate. Can you ambulate? Can you bear weight? Do you use a walker? Do you use a wheelchair? Again, all important things. In the next section, it talks about your specific likes and dislikes. This may seem kind of superficial or silly, but it's actually really important. For instance, some people love to have a massage. Other patients do not want to be touched. Some patients love to have visits from animals. Others may be allergic or fearful or just don't like animals. So these kind of things are really important to specify under your likes and dislikes. As I mentioned, in the back, there's an area, 2 pages, for additional notes. You can list additional medications here, additional medical history, whatever there wasn't room for in the body of the pamphlet, you can add here. And you want to make sure that you indicate who completed this and when they completed it. You may find that you have to update this frequently as your condition changes. On the back cover, there's information as far as getting in touch with the Les Turner ALS Foundation. Our address, our phone numbers, social media contact, and of course our website. Now, you may wonder, when will I use something like this? You may find it useful when you introduce a new caregiver at home. It allows the caregiver to really get to know you without exhausting you with an abundance of questions. They'll get to know your daily routine, your likes, your dislikes, and also have easy and quick access to very important specific information in the event of an emergency should they need to reach out to someone. You may also find it useful should you be on hospice services and find for whatever reason that you need to be transferred to their inpatient unit. At the hospice inpatient unit, you'll be under the care of a different team, and that team may not be familiar with your individual needs or your daily routine. And this communication passport could be found to be very useful. And finally, God forbid you find yourself in an emergent situation, needing to go to the ER or having a hospital admission. In this situation, especially, the communication passport could be very beneficial. Unfortunately, during this past year, experiencing the COVID-19 pandemic, we found that many hospitals have had to adjust their visitation guidelines, and many do not allow any visitors, including close family members. For any patient, the absence of this lifeline can be devastating, but especially so for an ALS patient who does not have the ability to communicate. So I ask you to take the time to sit down with your loved one and fill this communication passport out so that you have it at the ready. We always say, we hope for the best, but we prepare for the worst. If you never use this, that's great. But I don't want you to be in a situation in the midst of a crisis, not being able to communicate your needs, your wants, your desires, and not have a way to do that. I would recommend filling out both a hard copy and a digital format, and you can find both formats on our website. If you have any trouble at all completing this, just reach out to your support services coordinator. We'd be more than happy to assist you. I hope that you found this video useful, and I hope you do take the time to complete the My ALS Communication Passport for quality care. I would now like to welcome Rosie Riley, a person living with ALS. Thank you so much, Rosie, for joining us today to offer a patient perspective on the importance and the benefits of the My ALS Communication Passport to quality care. As your personal support services coordinator with the Les Turner ALS Foundation, I'm aware that you were diagnosed with ALS in July of 2019. It was just a year later that you lost the ability to verbally communicate. So I would imagine that this tool would become quite beneficial in your situation. Can you tell me, Rosie, did you find that the tool was easily accessible on the Les Turner ALS website, and was it easy to complete?
I found the Communication Passport tool easily accessible. Just go to the Les Turner website. In the Support Services tab, Additional Resources, and just click to download. I just typed in my answers and printed out 3 copies, 1 for my husband, and 2 more for my children.
Wonderful, and that's perfect to print those extra copies so that your loved ones do have a copy as well. Thank you for sharing that. Have you had the opportunity to use this tool yet, or has there been a situation where it could have been beneficial?
We recently drove to Florida, and my G-tube fell out in Effingham, Illinois. We immediately went to the emergency room, where my husband was with me, and I had my tablet with the type-to-speak app. It would have saved time if I had thought to bring my communication passport with me, as all my medications were listed on there, as well as my doctor's names and phone numbers. Additionally, It was difficult to type on my tablet while laying down flat on the exam table.
Those are really good points. And just in addition to that, as I mentioned in the video previously, even if you did have that information, if Mike hadn't been allowed to go into the ER with you because of the COVID situation, it would have been even more difficult, I would imagine, not having that information and being able to speak with your medical professionals to provide that. So I appreciate that additional information as well in your particular situation. Are there any other situations that you could see the use of this tool to be beneficial?
I think anytime you go to a new doctor or therapist, this would be a time saver, especially if you're like me and have difficulty answering questions.
Wonderful, great, thank you. And would you recommend this tool to others?
I would definitely recommend this tool to others. It doesn't take long to fill out and is so beneficial.
Excellent. Any other suggestions or tips that you would recommend regarding the use of the My ALS Communication Passport to quality care?
I would recommend periodically looking over your communications passport and updating it. When I returned home after my ER event, I pulled it out and found that the medications section was out of date, as was the section about speech.
Very good points, very good points. Well, I appreciate you sharing all of that information. I think this is a really important tool for patients, not only patients, but their loved ones as well, to give peace of mind and have this information easily accessible. So thank you for sharing with us today, Rosie. And I hope everyone has enjoyed the information that we've been presented today and finds this tool useful, not only for yourselves, but for those loved ones with ALS. Thank you so much and take care. Bye-bye.
Thank you, Karen and Rosie, for sharing your valuable perspective in providing this beneficial information and tool to others. We greatly appreciate that. Before we conclude the webinar today, I wanted to take an opportunity to show you how to access My ALS Communication Passport on our website in case you don't have the URL handy. You would simply go to lesturnерals.org. Then you would go to this tab called Support Services and click the down arrow, which would take you to ALS Resource Guide. You would click on that. And then you would simply scroll down to My ALS Communication Passport to Quality Care. You could download it here or ask us for hard copies at our office. Again, it's been a privilege spending time with you today, and we appreciate you taking time out of your day to spend time with us. Stay in touch, and we hope to hear from you again soon.